Palm Beach Groves was established in 1946, and this is our busy season, as you can see. I'm right now in the middle of renewing our healthcare for next year, and the premiums, the whole cost of healthcare for 4 employees, which covers 9 people, is going to be about $75,000 next year. It's exceedingly difficult because the cost is, every year we're looking at 15 to 20% increases. Each and every year, whether we use it a lot, don't use it, it doesn't matter. So, I mean, those are $75,000 for us next year. That's a huge amount of money. That's a lot of oranges to sell, let me tell you.
Back in the early 90s, almost 95% of every dollar that you would pay to a health insurance company for a premium would go towards actual healthcare delivery. When you pay your healthcare premium, too often, many Americans are only getting 84% or less in the healthcare that they're paying for. Medicare continues to pay about almost 98% of your premiums go to healthcare. Most private healthcare companies spend more and more on things other than healthcare. Things like executive salaries, profits, advertising, lobbying, red tape, not for doctors, hospitals, medicine, and other things that you need in the healthcare delivery system.
So what we're talking about is reining in the insurance companies, and one way to do that is to set a medical loss ratio, require that more of our premium dollars that we're spending as patients and as employers actually go to the direct care.
And when we talk about containing costs moving forward in healthcare reform, it's a very good way to contain costs.
We talked about doing the 10-pound box.
Okay. When you're like a group like us is 4 people or 1 person there, it's impossible. And most people will have a pre-existing condition or whatever. So you're looking at premiums. The premiums for me, I turned 50 this year. Thank you very much. Happy birthday. Another $250 on top of what I paid, because they can also discriminate by gender and by age.
So I think that patients and consumers and small businesses would agree that the more money that goes actually to healthcare delivery versus profits and CEO salaries is a good thing.
And that's just what's fair and what's needed right now to help rein in costs of our overall healthcare system, because right now it's out of control, and those that are benefiting are the CEOs of insurance companies, the stockholders, but the patients, the employers, the consumers are suffering.
I cannot give anybody any raises. Every year the raise is being eaten up with the healthcare, and we just need help. And sometimes I think everybody likes to help small business. It's very important to them. And sometimes I really think we're just too small to matter.